Episode 4, EASIFY with WORDIFY. I am Ayush. I am OET and IELTS trainer with WORDIFY Overseas, and we're going to have a lesson on OET writing, and we're going to talk about discharge letter of OET, how to write it, how to read, and how to plan the letter. And we're going to talk about all the ins and outs of OET discharge letter. So please brace yourself and make notes if you want. Let's start. So first, I'm going to share my screen with you. Second. Here we go. So I'm going to start the lesson now. Give me a second. So let's start. The OET discharge letter. So right, so the lesson is going to be about the OET discharge letter here, and I will share notes with you, the case notes of the letter and the sample of it, which we have written. In the end, we will also talk about some grammar used in that letter, and this lesson would be specifically looking at the selection of the right relevant notes and how to organize them into effective sentencing and paragraphing. So that's this lesson is going to be. Before starting our lesson, let's look at the writing format, which mostly all the OET letters follow. So you have to remember that and keep it in mind that all the OET letters are formal letters. So you have your approach and your tone should be appropriate and formal. You are mostly writing to nurses and doctors, so your tone should be formal all the way. The most common type of letter which OET students get in exams is referral or discharge letter. There's also another type which is called the transfer letter. It's not that common, but still appears in exam once in a while. But the most important or the common ones are discharge letters and referral letters. And today we are going to talk about the discharge letter in particular. All the letters are professional specific. So there are letter for nurses, there are letter for dentists, there are letter for physiotherapists, and all the other medical professions. But all the letters have this requirement or a suggestion, I would say, of word limit, which is 180 to 200. Again, I would like to repeat myself that it's a suggestion that approximately you have to write a 180 words to 200 word letter. It's not a hard and fast rule which you have to follow, but this limit which is given by OET is for your help. So you can you would not write too much of a letter or very short version of it. So the information which is given and the task which is given in the OET letter is written in a keeping that in mind, that the whole information will be comprised under 180, 200 words. So you have to keep that in your mind also. Now let's look at the stages we have to follow. while writing any of a OET letter. The first step and the most important step, I would say, is identifying the purpose. Each and every letter has a specific purpose, and you have to follow, you have to find that purpose and write accordingly. So identifying the purpose is the most important thing you have to do. How to find that purpose? This lesson is all about that. We're going to talk about how to find that purpose and how to write according to that purpose only, and nothing else, because that's OET wants. It wants you to be on that purpose. That's your test actually, to identify the purpose and write relevant on that only. So how to do that? The next step is to select a selection of relevant notes. And if you are new to OET, or if you have written one or two or many letters, you know that you are given a case note. You will be given case notes of a patient, and a lot of information will be there in the case note, but not all the information is relevant. That is also a part of your task, that you have to find the relevant information only. That's the criteria which is called conciseness, right? So selection is very, very important. We'll also talk a little about selection of the right notes and right information, how to do that, how to look for the right information in a discharge letter, particularly. After that, you have to organize. You have to organize your information. It can be done in many ways. It can be done chronologically. It can be done, in order of importance. In many emergency letters, you have to write the important information first, rather than following a chronological order or a order according to the dates of the information. It really depends on the letter you are given, but obviously you have to organize in a way. And I will also share a tip with you about discharge letters organization, how you really have to organize your discharge letter. After that, after selection and organizing your thoughts, you have to transform those thoughts into sentences. That's the really, that's the hard work you have to do. Have to transform those notes into sentences, into paragraphs, and you have to complete that body of the letter in around 180 to 200 words. And after doing that, the last step, but I would say last but not the least, very important, this can make a lot of difference. That is, the step is called proofreading or proofread. You have to read your letter after you write it down. It really can boost your scores, because no matter how much practice we have done and how much good we are at writing letters or essays or anything, it's very important to proofread whatever you have written, to make some upgradations or to find some errors, some unintentional errors you have done during the writing, because in a time-bound situation, people always tend to make some mistakes. So proofreading is as important as any of the steps I have discussed with you. Let's look at the timing now, how to use that time. If you don't know what time, which amount of time you are given in your OET letter, actually you are given 45 minutes altogether. Out of those 45 minutes, 5 minutes are for reading only. You are not allowed to touch the pencil for first 5 minutes only. And that time is given to you to read the notes only, to read and to understand the notes. And I think 5 minutes are enough, because the notes are very long, but not that long, like it will take you a lot of time. And the notes stay with you throughout your 45-minute time. So, but the first 5 minutes are just to understand the task. And after that, you are given 40 minutes to write it down. So the first 5 minutes, what you should do is, you should find what type of letter is given to you. That's the first thing you should do. Whether it's a referral letter or a discharge letter or a transfer letter. That's the first thing you should understand or comprehend, and then plan accordingly. You should find the purpose. Why are you writing this letter? Ask yourself why I'm writing this letter, to whom I'm writing this letter, what they want from me or what I want from them, because I am the one who is writing the letter. So what I want from the recipient. Do I know the recipient or not? That also makes a little difference here. And what is the main issue here? You have to look all these things. You have to ask all these questions to you. So make a checklist so you can check all these things. And after that, after reading, the next step is selection, as I told you. Selecting the relevant, semi-relevant, or irrelevant information is very important. So because you're given too much of information, more than necessary information, it's very important to categorize all the notes and all the case notes information you are given. So after these 5 minutes, the next 40 minutes you can spend on writing. And during these 40 minutes, there are 3 steps to follow. Obviously, organize and transform. Transforming your ideas, transforming whatever you have selected and using proper grammar. For grammar, I would say accuracy is the key. Always try to be accurate. OET doesn't ask for too much of a range from you as a candidate, but asks accuracy. So your lines, your sentences, your structures, everything should be very accurate. Accuracy is the key for OET letter writing. You should focus on your vocabulary also. You're writing to a professional here. You can use medical terminologies and other words here. You're not writing to a common person. Like speaking, you're not, the person who is reading this letter or the person you're writing this letter to is also a medical professional. So you can use some medical terminology here according to the context of the letter, of course. Your punctuation should be on point. Spelling must be correct. All these things are checked. We talked about organization, the paragraphing. You can do it chronological, but it really depends on the context. It really depends on whether your letter is emergency letter or not, or in the order of importance if it's an emergency letter. And after writing all this, you should proofread. You should check your letter. So this is how you should spend these 40 minutes. Now we're gonna look at the case notes of a letter. I will discuss these case notes with you, and we're gonna also read the sample with it. We're gonna look at the vocabulary and all other things. We're gonna select some information also. We're gonna do an activity where we can select information, how to select that. So here I'm going to give a tip also how to read actually. So whenever you get the case notes, which are very long 2-page case notes mostly you get in OET, the first thing you should do is go the very back, go at the last of the case notes where you are given a writing task. This is the most important thing. This is the first thing you should read. Rather than spending some time on case notes first, essentially you should read the writing task first. Why? Why would you would ask me why I should read the task first, not the case notes? Actually, this is the reason. We have to identify the purpose. What type of letter I'm writing? That's the first question you should ask yourself. Who are you writing the letter to? Why are you writing to them? What do you need to know? Does the recipient know the patient? Is it an urgent letter? All these questions will be answered in the writing task part, which I showed you, this one. All the questions will be answered in this part only. So again, we're going to look at these questions identify the purpose, what type of letter I'm writing, to whom I'm writing, why I'm writing to them, what do I need, or what do I need from them, or what they need to know actually, and the same thing. And does I know the recipient? Is it an urgent letter or not? So now for the next 20 seconds, I'm going to give you the screen and read the information, and then we're going to answer these questions. So let's read it first. The writing task. Using the information given in the case notes, write a letter of discharge to Miss Gold, the head nurse at Primore's nursing home. In your letter, briefly outline Mr. Gale is the patient, Mr. Gale's history, as well as your concerns and recommendation. I would say, read this line again. In your letter, briefly outline Mr. Gale's history, as well as your concerns and recommendations. Address the letter to Miss Jane Gold, okay, head nurse, Primore's Nursing Home, 3 Blackwood Street, Old Town. In your answer, expand the relevant notes into complex sentences. Do not use note form, use letter format. And the body of the letter should be approximately 180 to 200 words. That's the main thing. Now let's answer these questions we just looked at. So what type of letter I'm writing? I'm writing a discharge letter. I'm writing the letter to a head nurse. So remember this, because I'm writing to a head nurse of a nursing home, right? So what type of information she needs to know, what she can do with that information. Does she really need that information? If I'm selecting something, ask these questions to you. Why I'm writing to them? Because I'm asking for further care. I'm asking for ongoing care. I'm asking for further care and management of the patient. So here also you have to keep this in mind, that I'm asking to a head nurse, or I'm asking for further care to a nursing home's nurse, what type of information she would need for that care, and what I should select according to that. What do they need to know according to the task which is given to us? They asked us to write brief history, so we'll do that. They asked us to write the concerns, we'll do that too. And some requirements we have from the community nurse, whatever we want to, the nurse to do, the community nursing home to do. So we'll write that also. Does the recipient know the patient? Well, no. And is it an urgent letter? No, it's not an urgent letter. So now we have identified the purpose that we need, and we're asking for further care, and we are writing a discharge letter for a nurse here, where the requirements are brief history and concerns. Now we can go back and we can read the case notes from starting. Still, I would say you should read the last part, because in discharge letters, the last part is the most important. The discharge plan, actually, the day of discharge is the most important thing in any of the discharge letter. So here you should read that also, the last part of the case note, which is 15 May 2021, the patient is ready for discharge to a nursing home for temporary care. So the patient is going there for temporary care here. And what are the concerns? Patient lives alone, no home help. So that's the concern, that patient is alone, there's no home help for the patient. So that we have to mention, obviously, in the letter here. Keen to return to own home as soon as possible, ASAP. So the patient wants to go home, but he lives alone. And reading the next notes, I can see that his mobility is very lowered, significantly lowered actually, and that's why they want 30 minutes of physical activity every day to be encouraged. And still he has episodes of confusion, if you can read that. So assessment for independent living is recommended. That's why this information is given here, that he lives alone and there is no home help, and he came to return to his home, but still he is very confused, still he is disoriented, even at the day of discharge. So assessment is needed, encouragement is needed, and this is very important actually. This information is very important. The plan is here to write to the head nurse at the nursing home, which you are doing right now, so you don't have to mention this. Actually, this is the instruction for you. You are the nurse who are writing to the nursing home here. And now I think it's the time to go back to the starting of the notes and start reading the notes from the starting here. And we're going to find and select the relevant information only, which we're going to write. Remember, we are writing to a nurse of nursing home here, community nursing home, and we need further care. We need temporary care for the patient. And let's see what the patient had the problem and what problem the patient had and all these things. And let's select the right information for the discharge letter according to the requirements we were given. We were told in the writing task to give the brief history and also what are the concerns and plan for a discharge. So let's read the notes here. Assume, sometime they give you the date. Assume that today's date is 15 May 2021. If they give you the date, you write the same date in starting of your letter here. If they don't give you a date, write the date of your exam. But mostly they give you the date. Okay, this is also introduction here. You are a nurse at Old Town Hospital, responsible for the care of an elderly patient who was admitted after a fall. He is now ready to be discharged. So this is the information. This is a little background information they gave us, that you are the nurse here for an elderly patient who was admitted after a fall. He is now ready to be discharged. Okay, we are also given some patient details here. The name of the patient is George Gale. There's a date of birth also, 24 April 1936. Patient is 85 years old at the time the letter is being written. Address, he lives at 14 Long Street, Old Town. So that's his address, that's the patient detail. And after this, you are given social background and medical history. Now your selection comes into play. What type of information you think should be given to the nurse here who is responsible for the aftercare after the surgery or after the treatment? What type of care we need and what type of information we need to give. So again, I'll give you 20 seconds here to read this information, and you pick out what information is relevant, what is semi-relevant, or what is irrelevant here. It should not be added, which is not needed for the nurse at the nursing home for further care. So give you some time to look at this information, and we're going to select after that, after the time. So you have some time to look at it in your mind or on the notes. You just pick the information you think is relevant, irrelevant, then cross the information if you think it's irrelevant. Or if it's semi-relevant, you can mark a question mark in front of that note. So in the social background, we are told that he's a retired retail manager and he's a widower, wife died. Son, he has a son who is 47 years old, works abroad. That established why he lives alone. No family close by. There's no family here. Living alone in the own flat. I think this is very relevant information, living alone in his own flat. And like he's a retail manager, retired manager. This information is irrelevant to the nurse. This has nothing to do with the care of the patient or any importance to the care of the patient, which he will get after discharge. His son live alone. This is actually this is semi-relevant. If you want to add, you can. He's a widower, again semi-relevant. If you want to add, you can. He lives alone in his own flat. That's very relevant. We have to talk about that. He socializes with neighbor, independent, cooks, daily walk to shop. Again, this information at normal, I would say, at the normal circumstances, we think that this information is relevant, right? This is patient's background and everything. But in OET, they are very choosy, very picky, and we only have to pick the relevant notes which are relevant to the recipient here. Recipient would have no benefit of knowing that he cooks or walks, or that's not the concern for the community nursing home here. He's a drinker, he's a smoker, again, has nothing to do with his care, because this does not concern the community nurse or the nursing home. His medical history: in 2003, he has osteoarthritis. He was diagnosed with osteoarthritis. In 2009, hypertension. In 2013, GORD, which is self-treated, by the way, with antacid tablets. 2019, he has non-specific colitis. Ongoing monitoring. Now, the monitoring is ongoing. So this may be semi-relevant information. You may add it because the ongoing monitoring is needed here. No treatment is required, but ongoing monitoring is required. We don't have to talk about his GORD because this is already self-treated. So there's nothing, the nurse can do. If you want to write it down, you can. It's a semi-relevant information. Still, it's not that relevant. Okay, now let's look at this part of the case notes. Here, medications are given. Paracetamol, he takes paracetamol 500 mg, 2 tablets 4 times a day for his osteoarthritis, for maybe the pain. And he also takes phyllodipine 5 mg 1 times a day for his hypertension. Now, this information is relevant. Now, this is what the nurse should know, what type of medicine he needs on daily basis, because that's the care, right? That's the care the nurse should know about. Okay, the presenting complaint: disorientation and fever following fall. So when he fall, he was disoriented and he had fever. Again, a very relevant information with the background, because this is the main reason the patient was admitted. So all that information we read till now was not that relevant, semi-relevant, 1 or 2 points, but now the real things come. The medication on daily basis, very relevant. The presenting complaint, because we are asked to write about the background here. So we will talk about this disorientation and fever. Okay, now you can see his admission details are revealed here. Hospital admission, 10 May 2021, he was admitted. What he reports, self-reports, the patient self-reports: fall on 9 May while brushing teeth, felt weak, legs gave away, fell backward with a head strike. Approximately 5 hours he was laying on the floor. Neighbors heard the call for help around 300, which is 3 o'clock in the morning, 10 May, and called for the ambulance. So this is the whole background for that condition he had. We will add this information. We'll summarize this information, obviously, in the background paragraph. We are asked to do it. 2 weeks before the fall, 2 weeks before the main fall, he had a single episode of vomiting, palpitations, and dysuria. So this is also very relevant to the background of the care, because this is the reason he was admitted. Now, let's look at this thing. The objective vitals, so he was confused at the time of admission. He was confused. He was disoriented. His temperature was high. His BP was elevated. His pulse was normal. His respiratory rate was elevated. His urinalysis after the urinary tract, analysis. So he had more than 100,000 CFO per milliliter, which is obviously high. Hence, going to the diagnosis, which is urinary tract infection, UTI. And maybe that is the reason, that's a questionable thing, but maybe that's the reason of fall. That's why he fall, of the infection, because the infection is diagnosed. Now, many of the students will think that they should write this objective vitals, but that doesn't have to do anything with the community nurse and his aftercare, because this is all past. He was disoriented, confused on 10th of the May, not today. He had elevated BP, blood pressure, temperature, and elevated respiratory rate on that day, not today. If you read the next the case notes here, you will know everything is normal a day before your discharge. So this information is not relevant for the nurse here. What happened to him during the treatment is not relevant because it is now resolved. The things which are not resolved, these are things which are ongoing, things which he still need help with. That things we have to mention. So this is the treatment record. Again, everything is already done and everything was normal. You can add a line that discharge was uneventful. The vitals on the discharge day was uneventful, was normal, whatever you want to do. But still, you don't have to give a lot of details about the treatment record in a discharge letter, where the main concern is after care and after management, after the discharge, upon discharge. So you only need to add the admission day, diagnosis and everything. And then you can simply go to the discharge and write about the plans, about the requirements, about the problems, that concerns, the ongoing management, something you need, ongoing monitoring for something. You add these things in a discharge letter. So this is the end of the case note here. Now we are at the next step of our letter after selecting the relevant, semi-relevant, or irrelevant information. Now it's time for transforming your letter here. So I will, read the sample here and also will discuss the grammar used here simultaneously. So you start, obviously you write the recipient name and address and everything on top of this, but that's actually very established notion here. So everybody knows that, whoever writes the letter. But we are here talking about the lesson is more about organization, selection of the right information, and staying relevant throughout the letter to the task which is asked from you. That's very important. So we start with the name. We start with the recipient's name, Dear Miss Gold. We have this name. Remember, if you have the name, this will also important, and the ending phrase, I'll connect that dot also in the end. So yeah, you start with the recipient name, then you write the patient name, and if you're given the date of birth, you can write that, age also. And the next thing is the most important part of the letter, which is the purpose of the letter. The subject, the purpose, the introduction, whatever you call it, but this is the most important part of your OET letter. It has 3 marks separately from all other criteria. The purpose itself has 3 bands. And you can get 3 out of 3 if you are just very clear and straightforward with your purpose. If you read this, you can always start with, thank you for taking over Mr. George Gale's post-fall care. He's thanking in advance here, thanking for taking over Mr. George Gale's post-fall care. So the first time you write the name, you write full name. After that, you write Mr. Gale in the letter. I'm writing to provide a brief summary of his background and plan for temporary residential care upon discharge. So the purpose is very clear. I'm writing to provide a brief summary and a plan for ongoing care, for the aftercare. You can write anything upon discharge, temporary care, aftercare, ongoing care upon the discharge of patient. So that's the purpose. It's very short, but very clear. And it really talks about what the letter will be about. Now, if you read this purpose, you know there are two things: summary of background and plan. These are the two main part of the letter which you have to extend throughout the letter. The first part is the background now. This is the background here. And if I talk about the grammar here, it's very simple. I'm writing, it's present continuous. That's what we use. I'm writing to provide, nothing else, nothing fancy here, but accurate. Remember that. So now the background, Mr. Gale, comma, an 85-year-old widower, comma. So now here we start with Mr. Gale because we already given the full name. For now, for rest of the letter, if you use Mr. Gale's name, you only use the second name, Mr. Gale. You do not write the full name. You only use the full name only in the initial part, initial in the purpose only. That's it. So Mr. Gale, an 85-year-old widower, lives alone in his own flat. On 9 May, so you simply jump to the admission day. You don't have to give any irrelevant information. He has son and all. That doesn't help the nurse at all. It's irrelevant. He lives alone. We're writing this because the assessment and because the nurse has to assess if he's ready enough to go back to his house. So that's why we are establishing this fact that he lives alone in his own flat. On 9 May, he had a fall at home and hit his head. It was not till several hours later that his neighbors heard this cry for help and called the ambulance. Mr. Gale later said that he had suddenly felt very weak before he collapsed, before he collapsed. Very good vocabulary here. He reported a single episode of vomiting, a palpitation, and dysuria 2 weeks prior to this incident. This is a very important information. Mr. Gale was admitted to Old Town Hospital with fever and disorientation. Symptom later attributed to febrile urinary tract infection, UTI. So this is the whole background, his fall, his own story, and obviously his admission day vitals, his admission day, whatever the nurses then had the, reports. So you have to write that. That's very important for a discharge letter. You always start with the admission day, not a lot of details, but only what the diagnosis is and why he's being admitted, right? That's very, very important. You have to write that. They asked for the background. We talked about he lives alone. We also gave the story, how he hit his head and, had this episode of vomiting and palpitation and dysuria. That's very important to write. So we wrote that. The grammar here used, if you read it again, so the first line simply uses simple present, lives alone, verbs first form with S because Mr. Gale is a singular noun here. So the subject is singular, lives alone, had a fall, it's past, and it was not until several hours later, again, past for the past information. Mr. Gale later said, again, it was past. So he said that he had suddenly felt. He reported, again, the past tense, because you're talking about 9 May and you're writing on 15 here. So the past tense is used. Mr. Gale was admitted to the Old Town Hospital. Here it's a passive voice. Past, simple past, passive actually, was admitted. So you use was plus verb's third form with the subject in the front. And that's the grammar you used here. Now, after the brief summary, we're going to simply jump to the concerns and the discharge plan. That's the discharge letter is for actually. You have to talk about what requirements are, what you want from the recipient here. So Mr. Gale has hypertension. You go here chronologically because it's not an emergency letter. You don't have to talk about the plan and the requirements first and then the normal things. So he has hypertension and osteoarthritis, for which he takes fluidopine and paracetamol, respectively. He also requires regular monitoring for his non-specific C colitis. So this is information you should give actually. It's a semi-data information. We talked about that, but you can write because it's an ongoing monitoring and he takes this medicine every day. So the nurse should know that. Nurse does not know the patient beforehand. So that's why we are writing this. If the nurse would have known the patient, if there are so many letters where the patient is going back to the nursing home, in that scenario, we do not write the the regular medicines or the ongoing monitoring, because that already is known to the nurse because the patient came from that nursing home. But today, the patient is going to the nursing home first time. That's why it's important to find out if the patient knows the recipient or not, because then you have to add these lines where you give the everyday medicine regime also. So after that, the requirements, actually the main part of the discharge letter. Mr. Gale now has reduced mobility. Therefore, he needs to be encouraged to do 30 minutes of daily physical activity to regain his strength. Despite his UTI being successfully treated with IV antibiotics, he still has episode of confusion. So this is also information we have to give them. Although he is keen to return to his home, an assessment for independent living is strongly recommended prior to discharge from your facility. So this was the plan actually. And let's look at the grammar and again read this information here. Mr. Gale now has reduced mobility. So present tense, you are talking about now present because you are on 15th of May now, and has reduced mobility. Therefore, he needs. So it's again simple present. He needs with S because he is singular. He needs to be encouraged, so a little bit of passive here, to do 30 minutes of physical activity to regain his strength, despite his UTI being successfully treated with antibiotics, So there are two phrases now. This is a complex sentence which starts with despite. Despite he is treated, and the next phrase, he still has episode of confusion. So there are two phrases here, connected together, making it a complex sentence using despite. And the very next line again uses although. Now let's see the use of although here. Although he's keen to return his home. That's the first phrase. That's the first independent phrase here. Although he is keen to return to his home, you use comma instead of, like the sound here is of but. Although he's keen to return to his home, but an assessment is needed, right? But you do not use but, you use a comma here. Although he's keen to return to his home, an assessment for independent living is recommended prior to his discharge from your facility. And this is how you end this requirement paragraph. After this, you write an ending phrase, you write the greetings, and you do not write your name, you just write your designation. So your assistant would be greatly appreciated. You are again thanking in advance. Yours sincerely. Why we used yours sincerely instead of yours faithfully? Because we know the name of the nurse. In the starting, in the greeting, we used Dear Miss Gold. So if we know the name, we use yours sincerely. And if we use Dear Nurse, Dear Head Nurse, Dear Ma'am, we use yours faithfully. But today we know the name, we use that name. So we are going to use yours sincerely, the ending, and nurse. This is how you write a discharge letter. Now, so there are so many things about the selection we talked about, how to select the right information. Always keep in your mind that you are writing for further care. Most of the discharge letters are that. The only thing to look for is if the patient knows the recipient, then you can add some of the information. If the patient already knows the recipient, then you have to also omit the information which already maybe the nurse would know. because he came from the same nursing home. So you don't have to talk about all the old problems and anything, or ongoing medicine regime also, because the nurse would already know it. You only have to talk about what happened in the hospital and what the admission day. So this is the organization here. You start with the purpose. You talk little about admission day and nursing management. You summarize it in a very concise manner. You don't have to give all the details which have no use. So don't do that. You talk about the discharge day vitals. You can organize the paragraphs like this. And then you mainly talk about the discharge plan, the requirements, the needs, whatever you need from the nurse. This is how you write the discharge letter, a proficient manner here. We already looked at the grammar. And this is the assessment criteria actually. This assessment criteria needs a proper video on it. It's a lot of things to talk about, but these are the things they look in your letter. The purpose, I told you, the purpose is very important. It's criteria altogether, a separate criteria. So the content of the letter, being relevant actually gives you the higher band scores. If you're relevant, all the relevant information, if you do not miss any of the relevant information, you can get 7 band scores in your content. The conciseness and clarity. So see, first they check for all the relevant information. That comes under the content criteria. Then they check for any irrelevant information you would have or must have written. So then they give you on the assessment criteria of conciseness and clarity, how concise your essay was, your letter was. Then the genre and the style, which I told you is always formal. So be very formal. The tone should be very formal here. Do not use any abbreviations. Do not, ask direct questions, and talk very appropriately. Write very appropriately. The organization and the layout, we talked about that also. And the language, in the language, all the grammar, the punctuation, the accuracy, all that come, the structures and everything that comes under language. All these things are checked, and you are given score according to these band criteria. So I hope you would have learned something today, and you would have gained any insight into discharge letter. Obviously, we're gonna come up with more sessions like this. We're gonna talk about a lot of other letters here, a lot of tips and tricks. So subscribe to this channel and push that bell icon so you can get a notification the next time we are going to get live, and or we also post other videos here. So you get a lot of content. At Wordify, actually, we have one-to-one classes which you can join, and the demo classes are available throughout the week with flexible timing. So you can book a demo class and you can start your journey. You can kickstart your journey with Wordify. As we say here, EASIFY with Wordify. So stop dreaming and start doing. That's what I would say in the end. You can connect to us for all the socials here. You can scan this QR code. Thank you very much. This is it. This is Ayush from Wordify. I hope I would have helped you. Thank you very much.
Okay, Ayush, that was awesome. He dropped off.